a very special guest today, Dr. Srivadi or Vivitanakul. She is with, how do I do with that?
Exactly.
We lovingly call you Dr. O. Dr. O is a neurologist and movement disorder specialist in Phoenix, Arizona. She received her medical degree from Chulalongkorn University in Bangkok, Thailand, and she completed her neurology training at Case Western Reserve University in Cleveland and her movement disorders fellowship at Cleveland Clinic. She is a faculty physician at the Muhammad Ali Parkinson Center at Barrow Neurological Institute at Dignity Health St. Joseph's Hospital and Medical Center in Phoenix. And she treats patients with various movement disorders, including those with DBS, which is deep brain stimulation, and also specializes in treatment of patients with Huntington's disease. So we're so happy to have you here with us today. We are going to be talking about cognitive symptoms in HD. First, I'd like to thank you all for joining us. Thank you, Dr. O, for coming on and spending this precious time with us. And thank you to PMD Alliance for hosting and sponsoring this, and Teva Pharmaceuticals for funding this wonderful program that we have once a month. Every third Tuesday of the month, we have Lunch with Docs HD. And so, Dr. O, thank you again. Take it away. We have a great presentation today.
Okay, well, great. Thank you so much, Melissa, for the introduction, and also Margie also for inviting me to these great opportunities. I'm very excited to discuss with you all about cognitive symptoms that can happen in Huntington disease. You know, I think you are pretty much familiar with symptoms that can occur in Huntington disease, such as the involuntary movement, the choreiform movement, or the mood change that can happen due to Huntington disease. We're going to focus mainly on the cognitive change today. And I guess, you know, some of you probably kind of experience this change yourself, or have witnessed that in your family, your loved one. You know, it's very common for me to hear the patient complain that, oh, I have harder time talking, I have difficulty finding words, you know, it's harder for me to understand complicated things. You know, and difficulty thinking. So, you know, and many of you may probably familiar that, you know, as the disease advances, you know, you see more and more of this change. But, you know, scientists actually found that, you know, the cognitive change, my cognitive change actually can happen years before the onset of the chorea movement or the motor or the physical symptoms. You know, they found at least 10, 15 years a subtle change that they can detect. And as the disease progresses, this continues to change over time. You know, the reason that, you know, this cognitive change happened in Huntington disease is because, you know, the disease affected the brain in multiple areas, and one of the area that is, you know, pretty much affected the most is actually an area called caudate nucleus. It is an area that acts as a transit center. If you imagine, you know, FedEx or UPS, they has all these FedEx hub or transit center that acts as a area that kind of filter all the package, all the information, and decide like where or which one they should send it to. So, you know, this area of the brain is affected, so it cause multiple symptoms in your cognitive function. We're going to talk about communication, about memory, learning, about perception, and also executive function. So, you know, first one, very common problem is communication. You know, this is something that is very important for us in order to express what we need, you know, or how we feel, you know, our thinking, you know, and this part is affected by Huntington disease. You know, in order to communicate, that's to process, you know, the input has to come in, and then the output, you know, where you express yourself, you know, and both input and output process, you know, of communication can be affected by the disease. You know, it is harder for Huntington person to process and understand the information that coming in. It is harder for them to decide, you know, which response they would like to provide back, and also the process of forming sentence, finding word, and saying it out is also affected also. So again, it's, you may have experienced this yourself, or may see your family member have harder time understanding, especially when you talk in long sentence or use like a little bit complicated words or sentence. It can be harder for a person to understand. And also you may notice that it takes longer time for you to form sentence, to find words, or for your loved one to respond to your question. And not just that, the speech, the slur speech is another common problem also. I don't know if anybody would like to comment, like you have seen this in your family members or yourself. I don't know if audience can respond.
Dr. O, that is so true. And it seems to be very progressive, right? So it starts out kind of slow, and then it progresses to where it takes them longer and longer to respond to questions or requests of any kind. And I see that as well. But I would imagine it's not just Huntington's, right? It's other brain disorders that would also have that problem. Is that true?
That's really true. Very correct. And actually, that is actually part of our aging also. If you talk to, let's say, a 70-year-old person, they may actually complain of difficulty finding words, kind of same thing. Or even Parkinson patient, which is a patient population that we see a lot. They also have some of these problems too. So how can we cope or, work with this issue? There's a few things that you can do to help, when you talk or communicate to Huntington person. So firstly, try your best to be patient and allow them some extra time to respond. Normally you can, like when we talk, we just expect a person to respond right away. But with Huntington disease, it can take them, let's say 3-4 minutes before they, figure out, all the information that is, putting in and, process, forming a sentence to respond to you. So try to be patient and give them extra time to respond, usually helpful. Another thing you can do also is try to keep the sentence very short and simple. Like instead of, saying these long sentences, kind of break them and just say one simple sentence at a time. Another thing that may be helpful is also, instead of ask them open-end question, like simple question like, oh, honey, what would you like to have for dinner today? This is actually a very simple question, but for, more advanced Huntington person, this could be actually a difficult question for them. Thinking about it, they have to figure out, what is dinner, what meal it is. They have to decide what options they have, and they have to, find the right word for that kind of food and form a sentence and say it out. So these, simple process that we do without thinking every day can be harder for them. So, asking yes or no question, like, would you like pizza or sandwich, may be easier for them to actually respond to you, for them to respond as the disease progress. And if you have difficulty understanding what they say, you can try to encourage them to repeat or have them spell the word out if it is really hard to understand, or have them, let's say the first initial letter of that word, or just kind of say the keywords that they want to relay information to you. That can be helpful. And then as the disease progresses, it's going to be even harder for a person to respond. It's very common for the patient to getting quieter, and you wonder, like, why I asked you a question and you never answer to me. So it is harder. So sometimes as the disease become more advanced, you can try using like word cards or boards, that you can point to the picture. Okay, I want this, I feel this. So it could be another way to help with communication problems.
Okay, question on that, because I am experiencing that actually. And I don't know if this is a good idea, but you can tell me whether this is a good idea. If I'm asking a question and I'm not getting a response, what I will do is try to get in front of the person and try to get eye to eye with them and make eye contact. And sometimes that will then bring their attention toward me, where I can ask the question or offer the food or whatever, and they can say yes or no. But sometimes I've had to do that where I just have to like get right in front of their face. Is that?
I think that's actually very good suggestion, because try to get the attention is one important thing, because as the disease progress, it does affect your attention also. So you may Huntington person may not aware that you are talking to them, or unable to pay attention to the things that you are saying to them. So try to kind of have them focus to you, I think can be very helpful. Mhm. And also consider things like speech therapy can be helpful, practicing, saying the word out clearly, and also, help practicing, finding words, saying things out can be helpful.
So speech therapy for a slow response?
Yeah, so
Really?
speech therapists actually can do more than just help you speak clearly. A lot of time the speech therapists are actually trained to do what we call cognitive therapy also. So they can actually find strategy or compensation technique for you to help cope with all these change with your cognition, including the communication problem. They can help you practice, you look at the picture. There's actually a lot of apps these days that have these kind of games where you can look at a picture and you can guess what it is, or you can try to practice different way to compensate for this change. They will help find different kind of coping technique for this problem. Hello.
Does that seem to be frustrating for the patient?
I would say it can be difficult for patient who has more, some patient who has advanced symptom, because some other change that happen in the brain also that I will probably talk, maybe we can actually discuss about that now. So, besides the communication that can be affected, right? Other things that can happen in Huntington person is, lack of awareness, so this is very common change that we see in, I have patients sitting in the office have a lot of chorea involuntary movement, and I ask them like, how bothersome are these involuntary movement, the chorea movement to you? And they say, no, I don't have any chorea. So lack of awareness actually is part of the disease, or the patient are falling, the family say the patient fall every day, and I ask them, how do you feel about your balance, and ask them to use walker, and they can tell me like, I am fine, I have no problem with balance. So I mean, unawareness is a problem, a lot more in some than the other. So this could be a challenge, when you try to get the therapy for Huntington person. So and a lot of time it is actually not worth fighting with them also, like try to see like who is right or wrong, because it can easily lead to argument, and person become upset. I usually have the patient and family like focus on the action that I want them to do, instead of, oh no, you do have chorea, you do have balance problem. I typically just have them focus on like, okay, you need to take pill because you have Huntington disease and the doctor say you should take it, or the doctor want you to use the walker, and not like try to say, oh, you have gait and balance, and or you have to try like a creative different way to have a person do all these things, because sometimes they do not aware about all these change that have happened to the body. Any questions? Okay.
Doesn't look like I have any questions on that.
Okay. So, the next one that we would like to talk about is the problem with memory and learning. and also the thinking that is getting harder and slower. So with Huntington disease, all these change in the brain, affect all these skills that we have, to remember things, to recall things. So, I mean, if you imagine your brain is like a big library, and you have your librarian who, for some reason is very slow and disorganized, it takes so long time for them to do things. They don't keep the books in the right shelf. They don't categorize them. And when they, you ask them to look for a book, certain books, they don't have an organized way to search for that book. They may just randomly look at one shelf and then another shelf and not like go through, each of them, in, certain a pattern, and this can lead to a problem with Huntington person, have difficulty learning new skill, new information, or recall things, so it make it harder for them to remember, to learn new things. So it makes the thinking process kind of slower. So so when you have a patient with this problem, things that typically help them are try to break tasks for them into small, simple steps. Try to break things down, make it simple for them, one at a time. You may have to remind them, like taking medication is very easy for them to forget because they don't remember, to look for like all those, cabinet in our brain, like, what time I should take this certain pill, like just so hard for them. So you have to, send in a reminder to them. You may have to call them to remind them it's time for you to take pill, write down list of things that you want them to do. Even though you do have this problem, we still encourage the patient to try to practice doing things and try to learn new things and try to recall things, though, because even though you have problem, but if you don't use it, it's going to get worse. So even though it's harder, we still encourage you to do them.
So that saying, if you don't use it, you lose it, works for this too.
Yeah, I mean, to some degree, but you don't want to stress them too much either. But
No.
it's good to keep the brain exercise, to keep the brain active.
So keeping the tasks simple and broken down into parts, and continuous follow up and follow through with them, and patience is like key, right?
Correct. Yeah, you have to practice being patient a lot.
Yeah.
When working with Huntington, and I mean, not just Huntington patient, like, other patient who has cognitive problem, Alzheimer's patient, or even some Parkinson patient, it will take longer time for them to process all the information, to find all those memory and all those things that is stored in the brain. It's there, but it just take longer time for them, and the brain doesn't work in an organized way. So it's going to take longer time for them to learn things, to remember things, for you.
So I have a question. Why, and I'm not getting any questions in the chat, probably because I'm talking too much, but why is it that sometimes they will remember certain things and then other times they're just, it's not there?
Yeah, I think it depends on multiple reasons. So, first thing is usually things that happened long time ago in the past that has been there. It's stored in a very deep part in our brain. Usually that those things are still pretty much still there, but new information that they have to learn when the disease already affected, can be harder for them to recall, because again, the way the brain store information is not organized anymore once you have all these cognitive change. But things that happened in the past could be easier for them to remember because it's been in there for so long time. It is easier for them to talk about it. They have talked about it for so many times in the past, and that is something that happened in other condition also, like Alzheimer. Things that happened in the past, they tend to remember more than things that is recent.
Now, is cognition also affected early on? Like, I do recall trying to teach both my kids different things throughout the years, and it just kind of didn't stick. It didn't, maybe that was my fault for not, following through, and, I don't know. but I just felt like there was something not quite normal in their developmental years.
Yeah, correct. The change in terms of cognitive function actually was found to happen quite earlier than we thought. A lot of time we recognize Huntington disease when you develop the physical symptoms, when you have career, when you have balance problem. But the actual change in terms of your thinking, it can happen up to even 15 years before you develop all other physical symptoms. So there's this subtle change that happened for years, that maybe not recognized because it was so mild at the beginning, and you think maybe you just not pay attention, or you're not focusing, or you're not interested in things that I want to talk to you or teach you. So all these change can actually start 10-15 years before you have the physical change.
Yes, and as a young mother, trying to teach your children, it's a little frustrating when things aren't sticking, so to speak. And so now I know why.
Yeah, I see. And again, when you want to teach Huntington person something, I think repeat, repeat teaching them the same thing again and again usually help. Like practice still help with this. And again, break things into small, simple tasks. Have them learn one at a time. It can be helpful. Now I have another symptom that I want to discuss. Is actually very interesting when I learn about this. So the scientists found that Huntington person actually have problem with that perception. And that's two interesting things that I found. So they found that Huntington person can have problem with emotion recognition, from looking at the facial expression and from just hearing the tone of your voice. So there were a group of scientists that did the experiment where they show Huntington person photo of a person with different facial expression, like one per picture maybe they're sad, another one they're depressed, another one they're happy. And then they have Huntington person try to identify all the facial expression on these pictures, and they found that the patient has difficulty identifying all these emotion changed by looking at the person face, or actually by just listen to the tone of the voice. The person may not be able to recognize that, and this actually can happen years before the onset of the physical change also. And I mean, it seems to be like a subtle thing, but think about it, this can actually easily lead into a relationship problem, or you may feel like I'm so upset, I'm angry right now, why you don't seem to care or don't seem to aware that I am sad or I am upset, but it could easily be because they cannot recognize all these nonverbal cue that you try to express to them.
Do they feel the emotion and just can't express it, or?
So they actually cannot understand the emotion that you try to express to them. Let's say, maybe your children has Huntington, right? And let's say you are upset because they don't, keep all the toys in place, and you're so upset, like, you raise your voice, you show your face that you are unhappy that they don't keep all the stuff in place. But then they just doesn't seem to care. They don't seem to aware that you're upset about this. This actually could be because of the disease, but not because they're not caring about you. They just cannot recognize all the emotional expression and the tone of your voice. And to help cope with that, so when you talk to the person with Huntington, you may want to actually say your emotion to them clearly. Just state that I am unhappy, I am sad, I am depressed, instead of just kind of saying and use nonverbal cue, because they cannot detect these expression or emotion you want to show to them.
That's a really interesting point that I don't know very many people are recognizing so much. So I appreciate you bringing that up tremendously.
Yeah, I think it's kind of very interesting because, if you don't aware about this, you can easily thought that a person is not caring or doesn't, feel bothered that you are unhappy, you're upset, even though you kind of try to show them, because they don't realize unless you have to, you state it clearly to them. Yeah. So, this can, if you understand about this change, it can prevent you from, problem in relationship, knowing that your loved one doesn't look like they react to your feeling because they do not aware about it unless you clearly state the words to them that you're unhappy or sad. Okay.
So communication is quite a lot more complicated with Huntington's, and expressing your feelings in verbal form as opposed to showing, your
face
facial
or tone of your voice
expressions
they may
is
not be able
best.
to detect that.
Oh, good to know. Yep.
Yep. Now, another interesting part of the perception problem in Huntington person is they have problem with perception of time, like how long time has passed, So again, there's a group of scientists who did an experiment. So they have Huntington patient tap the finger to follow a rhythm of a metronome. And then after a while, they stop the metronome and have the patient keep tapping at the same pace that they tapped early on with the metronome. And they found the patient cannot figure out like how fast or how slow they should tap to keep the same pace. So they have this problem with, estimating how long time has passed. So maybe you will tell your kids that, or your loved one, like, okay, let's get ready, get dressed in 15 minutes so that we can go out for dinner. But then 30 minutes later, you see they are still, you figure out what to wear. I mean, it's, this example is not just because of only one problem with the perception of time, but there are other things that happen in the brain that make them take longer times to do things. So, when you have spatial things to do, spatial event to attend, to go outside house, you definitely want to, get extra time, plenty of time for a person. And then you may have to remind them like, okay, it's 10 minutes past, okay, we have 5 minutes left. But again, try not to like pressure them also, because they can get very anxious with that and make things even slower.
I think the big one for a lot of us who are caregivers of HD individuals is getting ready for doctor appointments, clinical trial appointments. It's almost like you have to start at least 2 or 3 hours before, just to give enough time, and you have to just go slow and be patient, because otherwise it can be so frustrating for everybody.
Yeah, I see. Yeah, I think that's very common, and that's very good point that you want to really, make sure you have extra time for any situation, any task that is out of your normal routine. Yeah, and now I'm going to move on and talk more about the executive function, which is a pretty important function of the brain that is affected by the disease. So executive function is something that you require for your day-to-day activities, and also a lot of things, if you are working also, it's things such as organization skills, planning skill, prioritization skill, making decision, attention, concentration, and solving problem. So all these, skills that you actually need for day-to-day activities and for your work is actually affected by the disease also. And again, these symptoms can start even before the onset of the physical change. So, I have seen many patients who doesn't have much, career movement, but they were not able to maintain jobs because of all these changes that happen to the brain. If that's a project that is, in a rush that have to be finished in a limited time, it can be very difficult for a person to prioritize things, to plan for things and organize, how can they finish those projects on time. And even simple day-to-day activities such as, again, good example, can you get dressed in 15 minutes to go out for a doctor appointment? Just to get dressed, it's actually can be very difficult things for a Huntington patient to do, because to figure out, what you have to dress, you have to think what kind of occasion is this, what kind of clothes would be appropriate to wear, is this shirt match with this, pants or not, is it a good thing that go together, or which part should I put on first? Should I put the shoes on first or shirt on first? Prioritizing, all these tasks. Actually, the simple things can be hard for a person to do also. And I don't know if any of you experience, these, change, but it is actually very important skills that we need, and it can be affected by the disease. Or even thinking about, let's say, maybe your wife used to plan for a big party for, let's say, holidays, invited all the friends and family, but now, it's going to be harder for a person to do that, because to plan for a party, you have to figure out like who would be an appropriate person to invite, what kind of menu or dishes will be good to be enough for a person, what ingredients are included, buying all the ingredients, which one to cook first, all these little small steps that we take for granted, we do it without thinking, can be very hard for a person. So, to help cope with this, again, if you want to have all these, tasks done, you actually may have to help a person break all these things into small, simple steps, kind of tell them, okay, let's think about who should we invite for the party first, list them down, help them, okay, next, let's try to plan for what dish, we should cook, and what ingredients we should buy, kind of help break things down into small, simple steps for them, have them do one at a time, usually helpful, help them prioritize which tasks should be done first, so these can be helpful things. And even in day-to-day activities like, getting dressed in the morning, shower, eating, it is usually very helpful to keep your day very structured, very routine, keep the patient structure the patient day very structured. Have them do the same thing at the same time every day. Make it like automatic. You get up in the morning, brush your teeth first, then change your clothes, then have breakfast. Keep it, very, very routine. It usually help them, dealing with this problem with, executive dysfunction in the brain.
Is this also including hygiene and personal, taking care of your personal needs?
Correct.
As well?
Yes, correct. These day-to-day activities, I mean, we do it without even thinking, but, truly, think about it. It actually requires a lot of planning, prioritization, organizing skill. You have to figure out, okay, to brush my teeth, I have to get the toothbrush, put the toothpaste on. I have to brush my teeth after I finish. Then I'm going to decide what clothes I'm going to wear for today, which, part I should put on first, my shirt or my pants, all these small little things actually can be affected by the disease, and it's continue to progress over time. So even, day-to-day activities like this could be hard for them. And I mean, another problem with the self-care is also problem with apathy or lack of motivation that happened from the change in the brain. So, it's very common also for the patient and the family to tell me, no, the patient doesn't want to shower anymore. They doesn't want to do anything. They just want to sit and watch TV, and they fall asleep so easy when they have this downtime. Like they look so lazy. They will kind of think kind of like that to me. But it's actually not because they are really lazy, but it is because of the brain make them just kind of, in this mode where it doesn't have motivation or interest to go out to have dinner with friends anymore, even though they used to be like very outgoing person. So it's all these change in the brain that is affected. So to help cope with this apathy or lack of interest, also you have to create a very structured day for them. You have to set routine for them, make them practice that again and again until it become like a habit for them. And also when the disease progress more, even though they have this set time, it is still harder for them to initiate the task by themselves. So you may end up have to help, initiate the task for them. Let's say it's dinner time. Even though you say, oh, honey, it's dinner time, they may not get up from the couch and still sit there. So you actually may have to kind of, gently encourage them, help them get up from the chair, put them into the dining table, put the food in front of them, even put a spoon in their hand to help, initiate the actual task, and they may be able to continue it by themselves, with your help. So, it could be very challenging, when the disease progress more.
What about sleep patterns? Why is it so hard for them to sleep at night and stay awake during the day.
Yeah, it is actually for multiple reasons, partly, the disease actually kind of affect your sleep on its own also. I have heard patients who either sleep too much or cannot fall asleep at all, and their cycle is, all over the place. They sleep at daytime and go to, and they watch TV whole night. It's because of disease that actually, kind of affect your sleep pattern also. But again, to help cope with this, with any patient with cognitive problem, actually, you just have to try to keep the day very structured, very routine for them. If they have sleep problem, at night, you want to make sure you try to shift that bedtime, set a specific time each day. Okay, this is a bedtime. We're going to turn off the light. We will set a tone, a relaxing tone in the bedroom, turn on soothing music, put them into bed, keep everything quiet and down, and try to get them to sleep. If it is very hard for them to sleep, you can ask the doctor to see if there's any medication that can help if you really need to. And then the daytime, you want to keep them awake. Don't let them fall asleep during the day randomly. Some patients will feel very tired and they need some naps during the day. You can do that, but you have to keep it structured, and you don't want to do it too late in the day. Like, let's say you can do it late morning or early afternoon, but don't do it at 6 p.m. because then at night you cannot fall asleep. So you want to keep them busy and active so that at night time, then they can fall asleep. And if they have to take naps, then schedule a certain time of the day, not too late, so they can kind of get some refreshment, get some more energy to do things during the day.
Easy to talk about, hard to do.
I know, yeah, it's quite hard, but it can be done. I have seen patients who have this problem, and the family, they try so hard. They try to shift the cycle, get them tired and do things during the day, so at nighttime they like fall asleep, and then don't let them like doze off too often during the day. Keep them awake. Okay, so next one, I'm going to talk about problem with impulsivity, disinhibition, which sometimes can easily lead to irritability and anger. So this is again because of the Huntington disease that is actually affected part of the brain. We have this part of the brain called frontal lobe, which is the area that is, the area that will kind of stop us from doing things that is, not appropriate, or things that can be hurtful to other people. Like, I don't like this person, I want to say this to them, but I still can stop myself because, my frontal lobe stopped me from doing that. Or I want to do this, things in public, but I know it's not appropriate because my frontal lobe stopped me. But with Huntington person, all these, part of the brain, is affected. So the person sometimes may, say things that could be hurtful to you, even though you try to help them, but they may say things that is not nice to you, or may do inappropriate things, or sometimes it could be more like a physical thing. For example, sometimes the patient will, actually very common, they may try to put too much food in the mouth, and then they choke because of that, because the brain doesn't stop, you from, doing that. Or, a patient who may have a lot of gait and balance problem, they try to get up so fast and try to walk so fast, even though they have balance problem, and they're very impulsive, in doing things. Or, sometimes it can lead to problem like, when, let's say, bad things happen in life, things doesn't go well, you can easily get, into, using alcohol or using drugs to solve the problem, because that part of the brain to stop these things is not functioning well anymore. So it's not uncommon to see a patient who will say, oh yeah, I have history with this abuse, alcohol abuse in the past or drug abuse in the past, because the brain cannot stop, from, all these things that is not good for you. I don't know, anybody has same problem, or even like sometime, like let's say something doesn't go along as expected, and let's say you're in a little bit argument, that sometimes can easily escalate it and into like an outburst or an anger that normally the person used to be very nice, and now with the Huntington, they change, they become very easily irritable, they get upset so easily. Sometimes they can be like, somewhat abusive or something, also, verbally or physically, because the part of the brain that's supposed to stop this behavior is not functioning well anymore.
Dr. O, is that also something that happens early on
Good
in the
question.
symptoms?
It's actually kind of varies, I mean, your cognition tie very closely to your mood and your behavior, and each person is a little bit different in terms of the symptom that manifests. I would say some patient, especially the one that has earlier onset of the symptom, let's say in a teenage year, in a 20s, the 30s, they tend to have more psychiatric problem. But it can happen in any part, any course, of any timeline of the illness. Some patients, fine for a long time, and all of a sudden they have this mood change, behavior change, and then it lasts for a while, and then it goes away. So it could be varies, but I would say a relatively younger person, sometimes they have more of psychiatric problem.
It seems like some of the impulsivity or outbursts can be very similar to Tourette's.
I would say to the outlook, you could be the resolve. It could be the same thing. I would say Tourette patient, it's different in the way that they a lot of time it's a tics that they have twitching of different part of the body, but some Tourette's patient will have time that they say like they curse, or they say inappropriate words, or they have like inappropriate gesture. So I mean, on the outside it actually can look kind of similar, but for the Tourette patient it tend to be like a burst out, like it's like a sudden movement or a sudden like verbal output that they do, and they feel relief when doing it. Actually, they have an urge to do it, and they feel relief when they do it, and they can suppress it to some degree when it's not too severe. But this is actually somewhat different than Huntington patient, that they actually have this problem because the filter of the brain actually not functioning well. So they actually say this thing, and they actually a lot of time feel sad afterwards, that they hurt your feeling, or they do this to you. It's just like they cannot stop it. They don't actually, I don't think they have an urge or feel really relieved to do it, but they just cannot stop themselves from doing it. It just happened. So, to help, coping with this situation. So first, if you end up in a situation when the person become very upset, first you want to stay very calm and stay in control. You don't want to become emotional together with them and try to raise your voice, because it's going to escalate the problem. And try to assess the situation, see if you can find trigger. A lot of time, you may be able to identify trigger, and the trigger sometimes can be very simple. Let's say sometimes because they are, outside their comfort zone, it's a different environment. There's a lot of stimulation, to them, too much to handle for them, or they just feel like they're hungry or thirsty. Could be because of, they are in pain, so, if by any chance, if you can identify this trigger and try to solve it for them, or try to avoid for them, it can prevent the situation from happen again, or getting escalate. And it's also nice to remind yourself that, even though they may say hurtful things to you, or do like, these inappropriate things to you, it is not because they're intentionally doing it. They don't intention to make you feel bad or hurt you, but it's just because of the disease that cause this change in the brain, so that and they cannot stop all these behavior, all these things from happening. And if the situation is escalated to the point that you feel unsafe, do not hesitate to call police too. Okay, so you want to make sure you remove all weapons or things that could be dangerous from your house, and then make sure you have emergency number next to you, on a easy area that you can find. So in case things all of a sudden just getting worse, you want to make sure you can find help. And also, again, I think we talk about this many times, keeping the person with Huntington day very structured, very routine is going to be helpful, because, if there's something change all of a sudden, they get confused, they're going to feel anxious and irritable and frustrated, and that can also easily leads to these behavioral problem or this change. So keep, a person, they're very structured, very routine. It's helpful. And if the things, getting worse to the point that, it's too much for me to handle, talk to your doctor, because there are medication that they can use to help suppress all these impulsivity, all these, outbursts, all these issues. Any questions we have on this? No? Okay. So, I think the last one actually I will talk is actually about perseveration. So, again, that part of the brain to inhibiting things is not functioning well anymore. So you may have seen like your loved one with Huntington, keep repeating things again and again to you. Let's say maybe they got a new, like maybe your kids got a new toys, or they may keep, talking about that again, or they may talk about, a achievement that they have. Let's say, I got this items from the store, and they may keep talking about that for a whole week, or they may upset at something. Let's say they cannot go out with friends last weekend because of the rain or something like that, and they just kind of keep talking about same thing again and again for a long time. So again, this is because of the brain. That's supposed to stop all these perseveration is not functioning properly, so you end up repeat all the things again. So if this is the case, try your best to, if you empathize with them, they probably not feel comfortable sometimes to keep repeating things again, either, and see if you can try distract them from this topic, by, you can try to use sense of humor, try to see if you can shift their focus, the idea. If it is very hard for you to shift the focus, the idea, sometimes you may just have to get along with them, kind of confirm that you hear what they want to tell you, so that they feel settled, they feel relieved that, okay, someone already know what I want to tell, to express. Or you can remind them, oh yeah, we already heard about that, you already tell us, so that they know that we already discussed about a topic. And again, if it is too much to the point that you cannot handle anymore, discuss with your doctor, because there are medication that can help calms down these situation. Okay.
Is that part of the obsessive compulsive behaviors, that perseveration?
Yes, yeah, it's kind of same
things over and over.
Again. Or, I have some patient who may, want to go to the workplace every day still, even though they haven't been working for years, they still want to do the same task. They want to go to do the same thing, they may want to eat same food every day. I want the same sandwich every day, something like that. So perseveration, kind of obsession, can also be part of this change from Huntington disease.
Oh boy, that's very familiar.
Yeah, so in summary, like you can see that there's many changes that can happen as part of the disease, and all these changes going to progress over the time, over the years. One important thing is if you are a caregiver for a person, you want to kind of periodically reassess all these change that happen, because there may be some intervention that you have to do. For example, at some point a person may not be able to take their own pills because they are disorganized, they cannot remember it's time to take medication. So you may actually have to kind of take over the medication management for them. This is actually a very common problem. Or driving ability is also another concerning task. Like as the disease progresses, the thought process, the reaction time is going to be slower. The judgment may not be right, so it may not be safe for a person to drive. And it is going to be hard to tell a person you should not drive anymore when they drive for 40 years. So one good way is actually to have them get driving evaluation. So there are something called driving to independence that you can get, like a medical evaluation for driving. Or, you can just go to the DMV and tell them you want roadside tests, so they can sit with a person when they drive and see if they're still safe on the road or not. And as the things progress, it is very common for Huntington person to need 24/7 care. So it's good to kind of reassess these change over the time, so we can prevent things from happen, like taking wrong pill, driving out, and has a problem on the street, and then you can plan for, let's say, long-term care for the person when the time comes, and you can discuss with them ahead of time so they can participate in decision making. They may even can go out to look at the place with you and see where they would like, when it's time, for them to move to facility or to get more help. Hello? I don't think I can hear your voice, Melissa.
I'm so sorry. Okay, very good information. Have you had any experience with juvenile Huntington's?
I would say, I seen a few younger onset patients, but mostly we only see adult. In Arizona, Phoenix Children's Hospital has a pediatrician who specializes in movement disorder and Huntington disease. So I think usually younger patient will go to them. So we see more older patient. I would say I have some in their 20s, but if they are like, young, like, like 5-6-year-old or like 10-11-year-old, I don't have that young patient.
They're referred to children's.
Yes.
Good. Yeah. I know there aren't that many, but it's always good to find out where to go.
Yeah, so Phoenix Children's Hospital, I hope I can say his name, Dr. Kruger. He's very nice, and he's actually very familiar with Huntington patients.
Very good. Thank you so much. Well, thank you so much for this talk. I didn't get any questions in the chat, interestingly. So I would like to just go ahead and wrap this up, and thank you again, Dr. O, for spending so much time with us. This has been a very enlightening presentation, and I will be putting it into a video for everybody to see, posting it on YouTube. And I'd like to send it to you first so that you can say, yes, this is good to go.
I see. Oh, thank you so much. And it's my pleasure to talk to everyone today. I hope there's some useful tips that you can use, for yourself or for your family, and have a great day.
Absolutely. Thank you so much.
Thank you, Melissa. Bye-bye.
Bye-bye. Thank you, everyone, for joining us today. We'll see you next month, third Tuesday of the month, on Lunch with Docs HD. Have a great month.
Okay, bye.
Bye-bye.